For more than 20 years, Healthcare Without Walls has been helping women and families by reaching beyond the usual settings. That meant going to places such as shelters or helping patients with challenges in housing, transportation, or even personal safety. Just recently, the organization opened one more point of contact, a clinic with free care for homeless women on West Street in downtown Boston. To tell us about the clinic and its place in a time of changing needs is the organization's founder and president, Dr. Roseanna Means. Thank you very much for being with us, Doctor.
Thank you, Chris.
Doctor, I thought that maybe this clinic was something you've been thinking of in the long term as a way of further growing your services and your reach, but this actually turned out to be a pivot from the pandemic. What led to this exactly?
Yes, that's exactly right. We have been providing free walk-in care under the good graces of many of the shelters in Boston for over 20 years, where the women could walk in, get other services, and then, by the way, see one of our nurses or doctors for anything that comes up acutely. And that was working out great until the pandemic shut everything down. And then the women just didn't have a place to walk into when something happened and they needed help with a prescription or pain or breathing issues or blood pressure or blood sugar. And so we have suffered like everybody else with how do we reach the people that we really care about. And so the board and the leadership of Healthcare Without Walls decided it was time to take the big plunge. And we found a rental space in downtown Boston, right near the Common, right within walking distance of all the overnight shelters, where the women could come in and see us. And so we're open 5 days a week on West Street, and we just opened last week. And now we're going to be able to provide the services that the women have come to depend on for so long.
Well, I think a lot of us understand the importance of primary care, catching things in an early stage, engaging people and having continuity of care, but you're dealing with what's known as gap care. What does that mean exactly?
That's right. I've been a physician for over 40 years, and the model of care that I was trained under was you set yourself up in your office, your patients make an appointment to come see you, you do an evaluation, you might write a prescription or do some tests, and then you follow up. But these are women who are out there, they're looking for food, they're looking for safety, they might not have transportation, they might not speak English as their first language. And so we learned a long time ago that even though these women have primary care or need to have the continuity of primary care, they also need someone to fill in the gaps. If they feel suddenly sick and it's the middle of the day and they can't get to their primary care or they don't have a phone to call them, where can they go? And we make it really easy for them to just walk in and be seen by a highly trained professional. And then we will communicate with that person to make sure that there is a continuity, and that if they have a chronic condition, that's being monitored safely and closely. So it's a really wonderful service for the women.
I want to ask you about the meaning of safety because it's pretty clear when it involves a situation of domestic violence that someone's trying to get away from. But on the other hand, there are cases when someone can feel unsafe in an institutional setting, like a hospital too. So what does that mean when you're trying to provide safety for someone?
Yeah, I think people sometimes think that all homeless people sort of come to homelessness through the same paths and have the same experience being homeless. But for women, over 95% of women come to homelessness with a background in domestic violence and experience homelessness and experience trauma once they have become homeless. And that may mean that they have been felt unsafe on the streets or outside the shelters, even within the shelters. And they just don't trust institutions or people in power who may have sometimes labeled them with stigmatizing diagnoses, mental health diagnoses that they may or may not have. Women that have ever been incarcerated or held in bondage might not want to be in an elevator or be in a room with one or two men if they've had experience with men. So all these kind of traumatizing events come up when they are interacting with the healthcare system. And so for the women who just want to have their medical needs taken care of in a place that is a model that understands women, treats women's issues, understands the role of trauma, that's what we offer them. They can come in and be seen and have it be confident nobody's listening in. They can tell us their stories, and they can get the help that they need.
One of the things that struck me when you talked about the needs of the women is that when those needs are being met, it's usually with a kind of care that requires a routine. And I guess that routine can be disrupted. I guess that means chronically you need to meet them again.
That is correct. We have women that we've seen literally for 20 years, even after they get housed, even after they settle down, the trust and the relationships that we've built up over time, they know they can come see us. We're not going to judge them. We don't do a big evaluation when they walk in the door. We don't say, well, you have to literally be homeless to get our services. If they have been homeless, if they have been housing insecure, they're welcome to see us at any time, even after they get settled, because those scars last a long time. And we kind of understand the context. It's very stigmatizing. It's very embarrassing and shaming for the women to have to admit that they were homeless. Society judges them. And if they go to a mainstream practice where the providers aren't well versed in the context of homelessness, it's not easy to say, well, I'm homeless, I'm living on the street, or I'm living in a car. And so they might not tell them that. But we kind of get it. And so they can come tell us anything and we'll accept them for, where they are in their journey.
Well, this clinic, to some degree, continues the work you've done at some of the satellite settings, like the shelters like Casa Munoz Vasquez or at Rosie's Place or the Women's Lunch Place. But why choose this particular location on West Street near downtown Boston?
Well, the West Street location is really great for us because it's right near the common between Tremont and Washington Street. So it's within walking distance of all the overnight shelters where the women that we're used to seeing stay. It's also near the T. So women who are housing insecure, for instance, we have a lot of older women who are about to lose their homes or have just recently lost their homes, and they might be staying with a relative or couch surfing. They can get to us on the T because Park Street's right there. And so we wanted to have a place that people felt that they could come to, that was familiar, available, easily recognizable, and was right in the heart of downtown Boston. And so that's why we picked the space. We feel really, really fortunate that we were able to find this location.
Did you think of any ways to make this look or feel different from a normal healthcare setting?
Well, I invite you to come down and see it. It's an office building. It's right off the street. You get buzzed in. You take the elevator to the sixth floor. It's beautiful, modern, clean, well lit. Makes people feel welcome. It's people sometimes might think, oh, a shelter is kind of dark and gloomy and underground, and might not have like really nice furniture because after all, these are poor folks. What do they care? This is all brand new furniture, which, by the way, was donated through the Furniture Trust, which is a nonprofit organization that helps nonprofits. And so everything is nice and new and clean and bright, and it sends the message that, you know what, we're going to treat you the way we would want to be treated. So it's a lovely, a loving place where the women are going to feel welcomed.
Speaking of how people are treated, I think this often means you do some routine medical encounters. You check someone's blood pressure or blood sugar level. It doesn't sound like much is happening there, but tell me, what's the potential? What could be going on?
Oh, absolutely. So these kind of chronic conditions, which are highly prevalent in this population, diabetes, hypertension, chronic conditions like asthma and emphysema, those need to be monitored. And if the woman has a primary care, but for a variety of reasons can't make it to those regular visits, it's important to make sure that those conditions are in control. Diabetes and hypertension can lead to strokes and heart attacks. Asthma exacerbations, as we've seen in the COVID pandemic, can lead to hospitalizations. A lot of emergency room use. The biggest impact that we have as an organization is because we are so available to these women. We're able to cut down substantially on inappropriate emergency room use, or cut it off before it becomes an emergency or a crisis. So this saves the taxpayers millions of dollars, because if those emergency room visits aren't being covered, then it comes out of our taxpayers. So this is a good thing that we're able to do that. And as I say, we close the loop by communicating with the primary care. And the primary care for women is all over the city. All the health centers and hospitals have women who are experiencing homelessness. They might not know who they are, but we know who they are.
Well, Doctor, finally, I know you've been up and running at the clinic for a little while so far, but you have an event to make this opening a little more official. Can you tell us what you've got planned for that?
That is right. We're so excited. In October, we're going to be having a clinic dedication event. And we're just starting the planning for that now. We're getting some of the dignitaries involved, Governor Baker and some of the other members of the government who have supported us. And we're going to be having an event that involves activities that will bring our donors closer to what the women need in terms of help and support. don't want to give away all the surprises, but we're very excited to engage the people who support us in understanding better what these women go through, because really it's just like you and me. There but for the grace of God go any of us. And so we want our donors to understand that what we're offering these women is what they would want if they were in these circumstances.
Well, thank you very much for taking the time to be with us.
It's my pleasure. Thank you so much, Chris.
Good to see you again, Dr. Roseanna Means from Healthcare Without Walls.